Hey everyone, Dr. H here with 𝒔𝒑𝒆𝒄𝒊𝒂𝒍𝒊𝒛𝒆, and I'm here to talk to you about a very specific technique that we use to adjust pregnant mamas, and that is called the Webster Technique. Webster Technique is designed to work and align the pelvis in a way that the baby can move around very freely, so that the baby will always be head down. The Webster Technique is designed to work on the sacrum, the pelvis, and the round ligament that hold the uterus onto the pelvis. So right here we have our patient here, Miss Taylor. Miss Taylor is 26 weeks pregnant. She's a breech right now, so we got feet down. Breech babies is not the optimal way that we want the babies to be in. We want the head down. So with the breech baby, it's very uncomfortable to mamas. I'm sure she can tell you that right now. So this is how a Webster Technique works. First, we let the mama just relax right here on this table. We got a comfortable pillow for her belly, and this is raised right above the pelvis to just let her belly relax onto that table. And this is raised to kind of help these muscles in the back, the calf and the hamstring there to just relax. So what I'm doing here, I'm just checking for that leg length in there. We're seeing that her leg is shorter by almost about 3/4 of an inch right there on the right side. And then we come up here and we just bring the legs back to that sacrum here and just check both sides here. We'll see one of them will go in a lot more than the other. And then we see that there is a restriction right here on her right sacrum. So how Webster Technique works is that we find that sacrum, and right here, as soon as I put my hand right there, I'm sure she can feel it. It's very tender to the touch right here. So these tables are designed to called drop tables. So they are designed to go about give or take about a half an inch or so. When the table drops, it is very specific to that segment right there. And don't worry, it's not going to drop onto the belly because she's got a pillow right here to protect her. So we're gonna just bring this up right here. Okay. Yep. Just gonna change the tension on here. Very good. There we go. There we go. Right. And more. Perfect. There we go. Right through here. Very good. And we come back and check the length of the legs right here. Now it is coming a lot shorter. They're becoming a lot more even now. Just the sacrum right through here. There it is. That was beautiful. Perfect. Even right there. I'm gonna go back right here. Going to check. See, they're both going back right. Both even going back there. Okay. Now, the other part of the Webster Technique is that we're actually going to work on some trigger points right around the round ligament. So round ligament actually holds the uterus onto the pelvis there. So for this one here, I'm gonna have Miss Taylor, go ahead, get off the table here. I'm gonna have you flip on your back so we can work on that belly there. Okay. Very good. Yep, perfect. Let's go ahead and lay on your back. All right, when it comes to round ligaments, it is almost always the opposite side of the side that was adjusted. So we got her right side adjusted there on her sacrum. So the her left round ligament is the one that needs to be worked on. And what happens here is that the baby is needs a lot of room in there to move around and become heads down. Now, when there is what's called torsion, basically the round ligament gets tight on one side and the sacrum gets misaligned or subluxated the other side, basically pulling on each side. and what it's not allowing for a lot of motion, a lot of movement in the in the uterus there. So it pulls it on both sides. So the round ligament is actually located right here, so right above the hip area, okay? And right here, we're just gonna just hold that. So we work on those round ligaments and kind of hold that position right there for about a minute, just until you feel that the ligament itself just kind of relaxes. And half the time you actually can feel a kick in there. Yeah. Right there, yep. There it is. Okay, perfect. All right, let me get you up, Ms. Taylor. All right, and that is it. That is how you adjust using the Webster technique.